My name is Carmen Connolly. I'm the Clinical Midwife Manager in Parent Education Services here at University Hospital Galway. Congratulations on your pregnancy. Birth is a normal event. It's also an active event, so preparation is key. While some pregnancies are planned, many are unplanned. Therefore, you may be feeling excited, but many women feel nervous and anxious too. This is normal. In University Hospital Galway, we're here to equip you with tools you need to achieve a positive birth experience. Antenatal education is an integral part of the preparation process. In UHG, we have an online booking system. I will show you now how to book your classes. Firstly, log on to our website www.uhgmaternity.com. The homepage will appear and it's worth viewing the following: the maternity virtual tour, the hypnobirthing track, the QR code for hand expression. To book your classes, click on the antenatal classes box on the top of the home page. Register. A menu of classes will appear. First time mothers, we recommend a 5-part program. This includes the following: your early pregnancy class. Ideally, you should do this under 20 weeks gestation. Your 2-part preparation for labour and transition to parenthood. There's a physiotherapy class, a breastfeeding webinar ran by our lactation consultants, a couples hypnobirthing program. This is available face-to-face. Baby basics program, so there's a variety of programs. If you've already had a baby, you're invited to a refresher class, and this is facilitated by the midwife and the physiotherapist. We also have a teens program if you're under 19 years of age. A one-to-one is available if you feel that you may need to see us on a one-to-one basis rather than in a group setting. After the birth of your baby, we have postnatal classes in person on the ward, and you're also invited to the New Mums Wellbeing Hub up to 6 weeks post-discharge from the hospital. This programme will help you and your partner to transition to parenthood by providing information and signposting to the many services that are available here in Galway. Our contact number is 091 544 210, or you can email us on parentcraft.uhg@hse.ie. We look forward to meeting you. Antenatal classes is also about making friends. Remember, you have everything you need to birth your baby. Thank you.
Hello, my name is June Barrett. I'm the Senior Dietitian here in the Maternity Unit at University Hospital Galway. It's my job to provide expert guidance and personalised nutrition intervention to ensure the well-being of both you, the expecting mum, and your developing baby. I work as part of the multidisciplinary team here to provide antenatal education at our early pregnancy classes. This session will provide you with all you need to know to eat well during pregnancy. I join my colleagues on a monthly basis at the New Mums Wellbeing Hub. At these sessions, I focus on your well-being to maximise your nutritional status postpartum. You will also find me on the maternity wards where I'm asked to review nutritionally challenging cases. You can be referred to me through your medical team or through your midwife in the outpatient setting, who will be happy to discuss your case with me.
Hi, my name is Clodagh and I am a midwife in the Community Midwifery Team and Early Transfer Home Service. I work with a team of midwives where we ensure women and babies have access to safe, high quality care in a setting that is most appropriate to their needs. The midwifery-led model of care is woman-centred and based on the premise that pregnancy and childbirth are normal life events. Women and their families are treated with dignity, respect and compassion and have the opportunity to make informed decisions about their care. The parents are supported before, during and after birth to allow them to give their babies the best start in life. Many women who choose this service often return to use it again for subsequent pregnancies. The midwifery-led clinics are situated across Galway City and County at the following locations: Knocknacarra, Duishka, Uachtarard, Athenry, Tuam and Gort. We also provide the early transfer home service for postnatal women and their babies within a geographical area close to the hospital. This service involves a discharge 8 to 24 hours after the birth. The women will have expert midwifery care, breastfeeding support and general newborn baby care advice for 4 consecutive days once they are at home. It gives the new parents confidence in caring for their baby in a supportive environment which they find invaluable.
Hello, my name is Liz and I work with specialist perinatal mental health services here in the maternity department, Galway University Hospital. Most of us expect to feel happy, excited and positive during pregnancy and when our baby is born. Of course, many of us do, but it doesn't always work out like this. It is natural to feel stressed or anxious at times during pregnancy. This stress and anxiety can be compounded during pregnancy, particularly if we already have a pre-existing mental health concern, or if the stresses in our life increase during pregnancy and impact on our mood and well-being. Up to 1 in 5 women have mental health problems during pregnancy or after birth. Some of these are mild and some are more severe. But there is effective help and support available. Here at the Maternity Department, Galway University Hospital, we have a multidisciplinary, dedicated perinatal mental health team. We aim to help you stay as well as possible during pregnancy and after your baby is born. With your consent, we include your partner and family, and we aim to give the best possible care, treatment, help and support to you and your family. The perinatal mental health team take referrals from your GP during your pregnancy and for up to 12 weeks postnatal, from the antenatal clinics, from the antenatal and postnatal wards, and from the maternity department assessment unit. You may never need to attend our service during your pregnancy, but if you do, know that we are here for you.
Hi, my name is Ali and I'm a medical social worker here in University Hospital Galway. Our maternity department has a dedicated medical social work team for its patients to avail of. We work to provide holistic support to patients as part of their overall health care. The medical social work service is confidential, voluntary, and available to all patients attending the maternity department. The main role of a medical social worker is to support you and your family with any psychological, emotional, social, or practical difficulties that may arise during pregnancy or after delivery. Some examples of challenges we can support you with are unplanned and crisis pregnancies, options counseling, pregnancy loss and bereavement care, coping with medical complications and difficult diagnoses for parents or for your baby, helping to cope with stress, anxiety, change, domestic abuse and safety planning, relationship difficulties, substance use and addiction, information and referrals for community support services, and any other practical and emotional support during and after your pregnancy. If you resonate with any of these challenges, or perhaps one that I haven't mentioned, please ask any member of the medical team for a medical social work referral. If you rather self-refer, please contact our department at 091 544 089.
Hello, my name is Mary and I'm a midwife working in the Parent Education Department here in GUH. Birth is a normal physiological process. Women have been giving birth for centuries and they do it very well. It is normal to have a degree of anxiety or fear around giving birth. This fear sets up an adrenaline response in the body which exacerbates tension and pain. Research proves that there is a strong mind-body connection between fear and pain. This creates the fear, tension, pain cycle, which is not beneficial to any woman in labour. Hypnobirthing is a tool that can be used to reverse this cycle and to promote comfort, calmness and control. Hypnobirthing is the use of breathing and relaxation techniques, visualization and massage in a calm birthing environment with the use of positive language. This approach reduces anxieties around birthing. It empowers the woman to believe in her ability to birth. It is important that both the woman and her support person learn these techniques together in preparation for their birth. Visit our website www.uhgmaternity.com to listen to our hypnobirthing script, download the hypnobirthing booklet and book your hypnobirthing class. We look forward to meeting you. Thank you.
Hello, my name is Edel and I'm a women's health physiotherapist here in GUH. The Women's Health Physiotherapy team are situated in the maternity department and provide both an outpatient and inpatient service to antenatal, postnatal and gynecology patients. Our antenatal service provides expert advice, education and exercise to help with issues related to pelvic health and continence. Your consultant, GP or midwife can refer you to physiotherapy. Many musculoskeletal changes occur during pregnancy and sometimes this can lead to pain and discomfort. The most common musculoskeletal issue is pelvic girdle pain, where 1 in 5 women will experience symptoms of pelvic girdle pain with varying severity. Pelvic girdle pain is the umbrella term that can include back pain, groin, hip and pubic bone pain. If you have symptoms of pelvic girdle pain, your consultant, GP or midwife will refer you to physiotherapy. Physiotherapy will send you a letter inviting you to book yourself into the pelvic girdle pain class. In the class, you will be provided with up-to-date evidence-based advice, education and exercises. You will also be provided with a home-based exercise program. Maternity belts and exercise progression are provided at one-to-one appointments after attending the pelvic girdle pain class. Women's Health Physiotherapy run regular virtual postnatal body care workshops. We also provide postnatal one-to-one appointments for issues relating to pelvic health and continence or delivery or pregnancy-related musculoskeletal issues. In the workshop, we discuss what is normal bladder and bowel function and or how to achieve it. We practice pelvic floor muscle exercises. We discuss up-to-date evidence and guidelines on general exercise and the safe return to sport. We talk about regaining and maintaining good posture and back care. We practice early abdominal strengthening exercises and how to assess and manage DRAM. The postnatal body care workshop is for every woman that is between 3 to 12 weeks postnatal. Phone 091 544 489 to book yourself in. For any postnatal pelvic health and continence issues or delivery or pregnancy related musculoskeletal issues, your consultant, GP or public health nurse can refer you into physiotherapy up to 12 weeks postnatal. You can watch a video on how to do your pelvic floor muscle exercises on the UHG maternity website. It is never too late to start pelvic floor muscle exercises. We look forward to meeting you.
Hi there, my name is Karen, and along with Ailish and Pauline, we are the clinical skills facilitators here in the maternity department of Galway University Hospital. We look forward to meeting you on your journey through our unit. You'll recognise us by this uniform, and you will find us across all areas of the maternity department, working alongside staff. We are a teaching hospital and strive for excellence in clinical practice and to provide high quality for all our service users. As clinical skills facilitators, we support all staff with any training or additional educational needs, ensuring standardised care through up-to-date evidence-based practices for the benefit of you, our service user, and your family in a safe and secure environment.
Welcome to the neonatal unit here at Galway University Hospital. We admit sick and premature infants not only from the maternity units here in Galway, but from the wider Sealth group. We admit around 400 infants a year. These infants are born either prematurely or are sick term infants that require advanced care. The length of time an infant stays with us varies from 24 hours to 6 months. Your infant will have an identified named nurse every day, and you will have the opportunity to meet the wider medical and multidisciplinary team on a daily basis. There are different levels of acuity here on the unit. Here in the intensive care room, infants are nursed in an incubator to allow close monitoring to enable them to recover comfortably. They may require breathing support and further intensive care therapies. For those infants that may require further specialist treatments, they may be transferred by a specialist trained team to Children's Health Ireland hospitals in Dublin. Here in the high dependency room, it is an initial step down from the intensive care, and infants here may also be nursed in an incubator to enable a watchful eye. They may still require some level of breathing support and also help with their feeding. They may or may not be receiving medication. Finally, in the special care room, it is the transition to home room, enabling infants and their parents to be fully supported in the preparation for home. Infants here may still require support with their feeding and close monitoring. The lactation room has 2 spaces for quiet time during expression of breast milk, as well as the option to pump at the infant's cot side. We also have the provision for safe storage of breast milk here on the unit. Our parents' room is a fantastic resource for all our parents to avail of. This room can be used by the family to room in with their infant prior to discharge in a supportive environment. As well as transitioning for home, this space is also available to parents that want to be near their infant, especially those who live far away. We wish you all the best in your pregnancy journey.
Hello, my name is Helen Burns and I'm the bereavement support midwife in Galway University Hospital. My role is to provide compassionate care to parents experiencing all types of pregnancy loss and neonatal death. I work in the hospital as part of the multidisciplinary team providing bereavement support. I provide emotional and practical support during your hospital stay and as a link to the maternity services following discharge. While in hospital, I provide resources, comfort, and I'm someone to talk to as you walk this very difficult path. Following discharge, I work with families to try to help navigate the grief journey by providing support, signposting, and coordinating your follow-up appointment with your obstetrician for results and future planning. I also provide support in pregnancy after loss. I can be contacted by phoning 087 771 2329 or emailing helen.burns@hse.ie.
Hello, my name is Pauline Tarpey and I am one of 3 clinical skills facilitators here in our maternity unit. The aim of this demonstration is to guide you through the self-administration of tinzaparin. Tinzaparin, more commonly known as Inahep, may be prescribed for you by your obstetrician during or after pregnancy following a maternal thromboprophylaxis risk assessment. This is a standardised tool that is in your healthcare records. All women will have a risk assessment for venous thrombosis documented at your booking antenatal visit. You will be reassessed again at your 28-week antenatal visit and at every episode of hospitalisation, post your delivery and prior to discharge home postnatally. If you are identified to be at risk of venous thrombosis, a treatment will be discussed with you and a management plan will be documented in your maternal healthcare record. Your obstetrician may recommend and prescribe Inahep for the prevention or treatment of thrombosis. Part of healthcare professionals' role is to support you with education on the self-administration of Inahep. So initially, wash your hands thoroughly with soap and water. Dry your hands. Sit or lie in a position so you can see where you are going to inject yourself. You can inject on the right or left side of your abdomen, at least 2 inches away from your belly button, or on the side of your thigh, upper leg or upper arm. Avoid any scars, bruises or stretch marks. Change the place you inject each time and stay at least 1 inch away from your last injection site. Your medication should be ideally at room temperature when you inject. This can minimize any discomfort. Open the container lid. Remove the syringe from the container. Bend the safety device down and away from the cap on the needle. Take care not to remove the protective needle cap before the safety device has been bent away. Remove the protective needle cap without bending the needle. Gently pinch a fold of skin in the area you are going to inject yourself. Fully insert the needle at a right angle. The injection should be administered in the subcutaneous layer just below the skin into the fatty tissue. Holding the skin fold, inject slowly over 10 to 15 seconds, delivering the medicine into the fatty tissue. Remove the needle and release the skin. Do not massage or rub the area as this can lead to bruising. Use a hard surface and bend the safety device to its original position. Do not use your finger to do this. Push downwards on the surface until the needle is locked in the safety device. Handle the used syringe with care. Dispose of it in a sharps container immediately. If you experience any side effects to your medicine, talk to your doctor, your pharmacist, or your healthcare professional. Thank you.
My name is Annette Burke and I'm the Clinical Midwife Manager of the Fetal Ultrasound Department here in University Hospital Galway. Congratulations on your pregnancy. Ultrasound uses high-frequency sound waves that cannot be heard by the human ear to produce an image of your baby, the womb and the afterbirth. It is a non-invasive screening test and is safe for use in pregnancy. Here in University Hospital Galway, we offer you 2 routine scans once you have booked your antenatal care with us. The first routine scan is offered between 11 weeks and 13 weeks and 6 days. For many, this will be the first opportunity to see their baby's heart beating and is an exciting and emotional time. We will measure your baby and confirm your estimated due date. We will also check how many babies you are expecting and organise your appointment for your anomaly scan. Please have a full bladder for your appointment, as this helps us to clearly see your baby. The second scan offered is the fetal anomaly scan and is usually performed between 20 and 22 weeks. This scan is beneficial as we can examine the growth and the structure of your baby. We will also assess the amniotic fluid and the location of the placenta. If you wish to know your baby's gender, we can check that too at this stage of pregnancy, but you should be aware that we cannot always see this clearly due to the position of the baby. This scan takes up to 30 minutes. It is also important to understand that unfortunately, ultrasound cannot diagnose all fetal abnormalities and does not exclude chromosomal abnormalities. In most cases, your ultrasound will be reassuring. However, if we do see any concerns, you will be informed at this stage and further appropriate follow-up care will be arranged. You will be asked to sign a consent form for this scan. If your anomaly scan is normal, then further ultrasound scans are only performed if there's a clinical indication, such as pain or bleeding or concerns regarding fetal growth or movement. Your partner or one other adult are most welcome to attend your ultrasound appointments. However, children are not permitted in our ultrasound department. Recording devices are also not permitted, but when possible, we will give you an ultrasound photo to take home with you. We look forward to meeting you on the day.
Gestational diabetes is one of the most common health problems that can happen during pregnancy. It affects as many as 12% of pregnancies in Ireland and can lead to serious problems for both mum and baby. Certain women are at higher risk of developing gestational diabetes. For example, if you are overweight, if you have a family member with diabetes, if you had gestational diabetes in a previous pregnancy, or depending on your ethnic background. If you are at risk, you will receive a blood test for gestational diabetes between 24 and 28 weeks of pregnancy. If you are diagnosed, there are day-to-day changes you can make to stay healthy. How much exercise you get and what kind of food you eat can have important effects on your health and your baby's health. But what happens when you have gestational diabetes, and how can diet and exercise help? Food and drinks are broken down in your digestive system. The sugar they contain is absorbed into your bloodstream. But sugar needs insulin to work. Insulin is made by the pancreas and helps sugar get into your cells. Insulin acts like a key that lets the sugar move from the bloodstream into the cells of your body, where it is used for energy. Pregnancy hormones change the way insulin works in your body. In the later stages of pregnancy, these changes make it difficult for insulin to unlock the cells and allow the sugar to enter. This is what is known as insulin resistance. Some insulin resistance is normal in pregnancy, but this means that your pancreas needs to work extra hard to keep blood sugar levels in a healthy range. When you have gestational diabetes, your pancreas is not able to keep up. As a result, too much sugar is left in the blood. However, a carefully planned diet with high-fibre carbohydrates and no added sugar can make it easier for your body to manage the sugar in your blood. Exercise will also help keep blood sugar low, as it improves insulin's ability to unlock the cells and uses up sugar for energy. If blood sugar is controlled, your chances of a healthy pregnancy are the same as a non-diabetic mum. This makes diet and exercise powerful tools for a healthy pregnancy. However, if blood sugar is not well controlled, this can lead to problems in both mum and baby. In a study of 23,000 pregnant women around the world, researchers found a link between high blood sugar in mum and babies that had grown too big. Researchers also found a link between high blood sugar and preeclampsia, premature delivery, need for caesarean section, birth injury, and abnormal sugar control in baby. Diabetes during pregnancy can also put you and your baby at risk for problems later in life, including type 2 diabetes and heart disease. But there are actions you can take. Changes in diet and exercise, combined with close monitoring, can successfully manage blood sugar in 7 out of 10 pregnancies. So no better time to start than now. To learn more about Irish research on maternal and newborn health, you can visit the HRB Mother and Baby Clinical Trial Network.
Hello, my name is Dr. Julie Higgins. I'm a midwife who works for the Celta Hospital Group, and today I'm going to talk to you about using a birthing ball in pregnancy and labour. If you have any questions, you can talk to your midwife or physiotherapist. It is very important to choose the right size ball for yourself and to make sure that it is safe to use. All of the Celta Group maternity hospitals recommend you buy a birthing ball that is compliant with the European Device Quality Directive. Information on companies that acknowledge their compliance and to learn more about finding the right size ball for yourself are available in our online information leaflet, The Use of the Birthing Ball in Pregnancy and Labour. First things first. To sit on the ball safely, you steady the base with your hands as you sit down. Put your feet firmly on the ground, shoulder width apart, with your hips about 10 centimetres above your knees. Being active and staying upright for as long as possible during labour has many benefits for you and your baby. Using a birthing ball during your pregnancy aids relaxation, may help to strengthen your abdominal and lower back muscles, eases back pain, and allows you to practice positions for labour and birth. Positions to use on the birthing ball can be bouncing up and down, circling, doing figure of 8, and kneeling. When you practice these positions during your pregnancy, you become very familiar with them and you're more comfortable moving into these positions during labour. A very common position women adopt in labour is the kneeling position. This position encourages physical and mental relaxation. Lying forward on a birthing ball can help to ease the pressure in your back, which most women experience at some point during labour. It is also a very natural position to birth your baby. To get into the kneeling position, first kneel, seated on your heels, with your legs slightly apart, arms and hands resting on the ball with your head turned to one side. Raise yourself up on your knees, lean over the birthing ball, and try rocking side to side or front to back. You can place a pillow under your knees for extra comfort. I've just mentioned a few positions that you can use with the birthing ball here. You will receive more information about other positions to use with your ball from your midwife or physiotherapist at your antenatal class.
My name is Lisa O'Halloran. I am the Clinical Midwife Manager in the Maternity Day Assessment Unit in University Hospital Galway. The Maternity Day Assessment Unit is a day ward and an emergency assessment area, which is open from 8 AM to 5 PM Monday to Friday. Outside of these hours, if you have an early pregnancy emergency, you can attend the main emergency department, or if you have an urgent issue from your second trimester onwards, you can attend the labour ward triage. You may be referred to the Maternity Day Assessment Unit by your obstetrician, midwife or GP, or another healthcare professional. This referral could be for a number of reasons to monitor your pregnancy more closely. If you are referred, a member of the MDAU team will contact you over the phone with an appointment date and time. Please note that MDAU appointments can often take a few hours. You can self-refer to the Maternity Day Assessment Unit if you have concerns about your pregnancy, for example, if your baby's movements are reduced, if you are bleeding or feeling unwell, or if you feel your labour has started. You can also attend for assessment after having your baby for up to 6 weeks post-delivery.
Hello, my name is Tara Ethuhil and I'm the Clinical Midwifery Manager of St Catherine's Antenatal Ward. Firstly, I'd like to congratulate you on your journey into parenthood. It can be such an exciting time in a person's life, but it can also leave you quite apprehensive, as each pregnancy is so different. Our antenatal ward is an 18-bedded unit, and the main reason for an admission to St Catherine's can be as a result of an unusual finding in the pregnancy that may require a short or lengthy stay on the unit. This will be decided by your obstetric team, and also a clear pathway of care will be discussed with you. We have a 4-bedded area for the induction of labour. The induction of labour process is artificially starting your labour before it happens naturally, and there are different methods to commence your induction. Each of these methods will be explained to you beforehand, and information is available on our website. There are many reasons why your labour may be started before your due date, and these are usually due to concerns for your baby's development or for your own health, such as diabetes or high blood pressure. The process can take up to 24 hours, and it is important to discuss your plan with your team at the antenatal clinic or on admission. And a great way to put forward and request things in relation to your preferences is a birth plan. Feel free to write down your preferences with your midwife or obstetrician. They're not set in stone and you can change your requests at any time. There are tools to help in your preparation for your impending birth, no matter what route baby is born. Alternative therapies such as hypnobirthing can be facilitated through our parent craft department. And there are a number of qualified hypnobirthing midwives working throughout the unit. We are also lucky enough to have some aromatherapy trained midwives that can advise you if it's safe to use these in your pregnancy. Wishing you a healthy and happy pregnancy.
Hi, my name is Rachel Curtis and I'm a midwife in the labour ward here in University Hospital Galway. Congratulations on your pregnancy. When you attend the labour ward for the birth of your baby, we invite you to bring one support person to be with you in labour. Together, you can discuss your birth plan or preferences with your midwife. Various coping strategies and pain relief options will be available to you, and these may be changed at any time. They do not need to be fully decided prior to your labour. If you are low risk and your pregnancy has been straightforward, you may be able to manage much of the early part of your labour at home. Contractions may start irregularly, gradually becoming closer together and more regular. It is always good to remain active, using your birthing ball and position changes to cope. You can have a bath or take a warm shower for pain relief. You can phone our maternity assessment unit or labour ward out-of-hours triage for advice from a midwife. When you are in established labour, you will be brought to a single room on the labour ward. Depending on your care pathway and level of risk, you may be able to avail of our low-risk birthing room and hydrotherapy pool. Warm water may be helpful in reducing your labour pain. Your baby's heartbeat will be checked while in the pool and your temperature monitored regularly. Your midwife will advise you on various birth positions. Keeping active and upright in labour may help shorten your labour by encouraging baby's descent as well as easing pain in labour. If your pregnancy is higher risk or it is not suitable for you to use the low-risk birth room, there are still many options available to you. If your baby needs continuous monitoring in labour, wireless monitors are available to assist you in using various positions and coping methods. There may be extra personnel in the room for the birth of your baby, for example, a second midwife or a paediatric doctor in certain circumstances. After the birth, you will remain on the labour ward for 1 to 2 hours before being transferred to the postnatal ward. If you are planning an elective cesarean section, a midwife from the labour ward will attend and care for your baby at C-section. Labour ward triage is available for any urgent or emergency assessments if you are more than 13 weeks pregnant. If you have any emergency and you are less than 13 weeks, you will need to attend the emergency department. For non-urgent assessment, please attend your GP. We wish you well in your pregnancy and look forward to seeing you on the labour ward.
Hello, my name is Natalia and I am going to discuss and explain what fetal monitoring is, why and how we do it. During your pregnancy, labour and birth, various assessments are carried out to ensure everything is progressing normally and your baby is not experiencing any difficulties. One such assessment is listening to the baby's heartbeat. Most babies go through pregnancy, labour and birth and are born without any problems. However, there are some babies who have difficulties, and the best way of finding out when a baby is experiencing difficulties is to listen to their heartbeat. You will be offered to have your baby's heartbeat monitored, known as fetal monitoring, during your pregnancy, labour and birth. Fetal monitoring can be done in 2 ways. Intermittent auscultation, listening for a short time at regular intervals with a Doppler or Pinard stethoscope. Continuous electronic fetal monitoring, EFM, known as continuous monitoring, using a cardiotocograph, CTG machine that draws a graph of your baby's heart rate and your surges or contractions. Intermittent auscultation is monitoring your baby's heartbeat by using a Pinard stethoscope or handheld Doppler. During your birth, the midwife will palpate your abdomen to feel for a contraction. They will listen to your baby's heartbeat for a full minute at the end of a surge or contraction. I'm going to just listen to your baby's heartbeat for a minute with Pinard. Is that okay? As labour progresses, your baby's heartbeat will be checked more often. In the first stage of labour, your baby's heartbeat will be monitored every 15 minutes and every 5 minutes in the second stage of labour. Your pulse will also be monitored at the same time to differentiate between your heart rate and your baby's heart rate. A cardiotocograph, CTG, carries out continuous fetal monitoring or electronic fetal monitoring. It produces a visual display and in some cases a paper recording of both the baby's heartbeat, the mother's heartbeat and any uterine activity. Two discs called transducers are placed on the abdomen with some gel. These are held in place with 2 elastic belts. Belts around here. One disc picks up the baby's heartbeat and the other disc picks up the frequency of the mother's uterine activity. Sounds like a happy baby. So this is the monitor to measure any uterine activity. So we put it here at the top of the uterus, okay? The machine produces a continuous graph of both of these referred to as the trace. The machine also produces a beating or pulsing sound that represents your baby's heartbeat.
Your blood pressure, heart rate, temperature and oxygen levels will be all checked regularly throughout your pregnancy and birth.
So I'll get you to put your finger in there. Yeah, and both numbers come up here, Vanessa. Just do this under your arm, lift your arm up.
You may also be given a clicker to push every time you feel your baby move.
Melissa, this is a little monitor to measure your baby's movements. So every time you feel your baby move, can you click the top button there?
Mobile CTG monitors are available to enable you to mobilise and change position while being monitored. If you're admitted to hospital with any issues after 26 weeks of pregnancy, a daily CTG will be recommended. If your pregnancy or birth is considered high risk for any reason, a CTG will be the recommended method of fetal monitoring during your baby's birth. A list of common reasons where continuous fetal monitoring is recommended can be found in your fetal monitoring leaflet. Your healthcare practitioner will discuss the recommended method of fetal monitoring with you. They will answer any questions you have, and your consent will be sought prior to carrying out any fetal monitoring.